Good afternoon, and thank you for joining us this afternoon at this important event for this community. We're going to be discussing some information on a very important project for the community's health, primarily. This is a program that has been in the works for over a year now, actually, and to help improve the care that our citizens receive when they suffer sudden cardiac arrest. And for many of you, I'm sure some of you have taken CPR training in the past and so on. This is particularly important and personal, as we will talk about shortly with some of our teams. We will emphasize this several times during our comments in the afternoon. This initiative is for the good of the community, and it involves the entire community. So number one, the citizens of Holland, I want to quickly say. Second of all, our public safety, Holland Fire, which is our sponsor for the program. 911 telecommunicators, the people that help you through assisting an injured or a cardiac arrest person. All the first responders, which of course include fire, police, EMS, ambulance, paramedics, and so on. And basically the hospital as well, obviously, is one of our partners. And we work very closely with them, especially in education and that type of thing. And we have all these team members that have been working together this past year. And it gets a little personal for me, but anyway, personal in that it works. And we're going to talk about that quite a bit here in the next half hour. So I'm going to turn it over to Angela, who I can't say enough good about, for being our project manager.
Thank you, Steve. Appreciate that. Hello, my name is Angela Lound. I am a firefighter EMT here with the City of Holland, and it is my honor to be able to introduce our Heart Safe Holland project team. This is a fantastic team. It should be noted that this is a work in progress. We've been adding fantastic members as we've been moving along and learning how to get this program up and running. And I'm sure we'll be adding more as we go, but this is our core group at this moment here. So you've already met Steve Stegman. He's a former paramedic with AMR and a community CPR educator. Jay Peters over there is a Holland citizen and a Holland City Councilman. John Shea is a cardiac arrest survivor, an assistant CPR instructor, and a member of the Rotary Club. Tim Webb is a paramedic and a field training officer with American Medical Response from West Michigan. Dr. John Cromer is an EMS physician and the medical director for our program. Susan Box is the director of member and community engagement for Evergreen Commons. Mark Cornelius is the community development coordinator and assistant planner for the City of Holland. Rajveer Kaur is the Ottawa County Department of Public Health. There. Marcia Achterhoff is a registered nurse with Holland Hospital. Lisa Carrillo is also a cardiac arrest survivor and a CPR instructor. Ryan Culver and Pete McWaters, who are representing Ottawa County Central Dispatch Authority. And Kathy DeVries and Catherine Rostillo-Bass from the Holland Rotary Clubs of Holland. And finally, they weren't able to be here today, but Captain Tinney and Fire Marshal Brett Grindike, whose training and guidance has been quite priceless to me as we've been moving through this. So at this point, I'd like to turn it over now to Dr. Cromer.
Thank you, Angela, and thank you all for not only participating in this, but giving me the opportunity to participate in it with you. I'm going to take just a couple minutes and talk about the medicine side of cardiac arrest, and there will be some things that will be thrown in there not immediately related to cardiac arrest, but point out the reason and the importance of this. In the United States, on an annual basis, about 350,000 people suffer a sudden cardiac arrest. That means they're awake and alert and go down like that and are unconscious and unresponsive because their heart has stopped. That's almost 1,000 people a day. When you look at what we have found over time, the national average is about 10% of those people that suffer a sudden cardiac arrest survive. When CPR is provided by citizens, the survival rate doubles at least. When there is citizen CPR, accompanied by the use of an automatic external defibrillator, a shock device. In some systems where those things happen very, very quickly, there is a survival rate that approaches 50%. So if you think about that, doing citizen CPR doubles the survival rate. Doing citizen CPR and adding an automatic external defibrillator can get to the point in well-formed systems where almost half of the victims survive that. Most of these events, about 72% in Michigan, occur in the home, which is, again, why it's important that citizens understand how to recognize and respond to a sudden cardiac arrest. About 15% of them occur in public places. Again, citizens are the first ones to engage in those things. In the City of Holland, in the last year, there have been 22 cardiac arrests and 5 survivals, which is a good thing. But we can do better, and we can improve on that. Now, I want to very briefly make a distinction between heart attack and sudden cardiac arrest, because when you hear things talked about on TV, they're often used interchangeably, and they are not. They're two distinct things. A heart attack occurs when the blood flow to the heart, for a number of reasons, is diminished. The heart is still functioning, it's still beating and circulating blood, but that causes the patient to start experiencing symptoms. You know, the thing that we typically talk about is substernal chest pain, an elephant sitting on your chest, you get short of breath, radiates to your left arm, you get lightheaded, dizzy, maybe a little nauseated. And those are the classic symptoms that we refer to. But we're continuing to learn, particularly in women, a lot of people don't demonstrate those classic signs and symptoms. If someone's experiencing a heart attack and they develop chest pain, it's important to call 911, get the ambulance to the scene as quickly as you can, because the EMTs and paramedics have medications and other skills that they can do to help treat the patient while they're being transported to the hospital. And then obviously once they get in the hospital, there's additional life-saving measures that can go on in the emergency department and other places. So when somebody's experiencing a heart attack, recognizing it and calling 911 is critical. Now, in distinction, a sudden cardiac arrest is what I alluded to a minute ago. Person's doing fine. In all honesty, they may be experiencing symptoms of a heart attack, but all of a sudden the heart stops and they go down. They'll be walking, they may be talking, and suddenly they lose consciousness and just face plant into the ground. They become unconscious, their breathing isn't normal, their heart isn't beating, and they have to be treated immediately, starting with CPR and defibrillated as quickly as possible. You know, the classic example that folks are talking about most commonly is the football player that went down a couple months ago on the field. That is a superb example of a team working together. The first trainer on the field started CPR immediately, called everybody else onto the field. That included an automated defibrillator. And they shocked the player, and he was conscious as they were pulling him off the field. Okay? The important part of all of this is that when the heart stops, for every minute that we delay starting CPR, the person's chance of survival decreases 10%. So we want to do hands-on as quickly as we can, do compressions, and as we'll talk about, we're focusing only on compression CPR. You know, many of you have learned in the past, if you've taken a Heart Association or Red Cross, they talk about rescue breathing, they talk about mouth-to-mouth ventilations, and they talk about the compressions. The most important component of that is the compressions. And even if you're doing only compressions for 4 or 5 minutes, that's still circulating enough oxygenating blood to the brain and to the heart to keep the patient alive. So what we're talking about here, and the emphasis of this program, is involving the community in recognizing recognizing a cardiac arrest, initiating CPR, activating the 911 system. Hopefully there will be a defibrillator on site, and part of this campaign is increasing the number of defibrillators in the community. But these are all things that citizens can do before healthcare providers even arrive on the scene. It's a critical part of the program. And I'm going to turn now to Jay and John to talk about really why it is so critical.
Thanks, Doctor. I'm really glad to be here today. I'm really glad to be here today. As many of you know, last October I suffered a sudden cardiac arrest. I had no symptoms. I had no expectation of that. I was a volunteer for the Community Action House. I was in a truck with Jay Peters, and to my eye, I just fell asleep. And after that, they tell me, Jay called 911 as the perfect first step, took me out of the truck in an interesting way, I guess. 400 pounds of fun came tumbling out of that truck, and immediately started CPR, started chest compressions on me. I was taken, shocked there in the parking lot. I was then taken from there to Zeeland Hospital, and I was airlifted to the Meyer Heart Center in Grand Rapids, and I was there about 7 days. And as I was thanking all the people involved in that chain of events, a chain of survival, every one of them kept pointing back at the first link in the chain and saying, if he hadn't done what he did, when he did it, as well as he did it, I couldn't have bothered to put a stent in you or done any of the other things. So I'm extremely grateful, and I'm glad to be part of this. Jay, do you want to take it from there? I wasn't awake, so.
Well, I contrast that with John's experience. When I was 10 years old, on December 27, I walked out of my bedroom and my mother was crying and just saying, she said, there's something wrong with your father. I said, well, where is, he's at work, I don't get it. I scratched my head and started walking toward the bathroom, and I saw him lying on the floor in the bathroom. And that was a time when you don't touch anybody, you don't do them, you just call the ambulance and hope for the best. So that's a that's a contrasting story to John's experience. Had I not had a simple 1-hour training, cajoled by Steve Stegman to take this training and explain to me why he thinks we should do this program, it never would have happened. He wouldn't be, 3 weeks before that happened, I got trained. Had I not, it would have been a different outcome. There's no doubt in my mind. But I think we're fortunate in Holland and Ottawa County that we do have a very good EMS system in place. All our Holland police cruisers carry AEDs and they're well trained. All of our HBW, Holland Board of Public Works vehicles, roaming the city, carry an AED, and they are all well trained. Ottawa County 911 operators are already trained on how do you handle a call when there's a sudden cardiac arrest, and trained to give CPR and AED instructions on the phone if that's needed at that time. John referenced the chain of survival. The first 3 links are the first and most critical to bring the other 3 links into a successful outcome. Link 1, call 911 immediately. Understand, identify what's going on and call 911. Link 2, start chest compressions. John's here because he was so lucky to have somebody sitting next to him in that event that within 2 minutes he was getting chest compressions. It's almost a luck game. And I think we can change that luck if more people understand what to do, don't be afraid, and just get involved, start chest compressions. The third link is use an AED. Find it. How many times you walk by an AED in a building and say, I have no idea what that is, I don't know how to use it. But if someone in your family was shopping at Meyer and you know they had an AED, would you know how to pull it off the wall and do it? That's what this is about, getting people comfortable with the notion that you can save someone's life. We're not These guys are phenomenal first responders, but in some cases, this program makes us all first responders because that's the first three links, and using the AD. That's what's going to save their lives. Because if you don't, as the doctor said, if you lay there for 5 or 6 or 7 minutes with no chest compressions, and they just lay there until the professionals get there, it's probably not going to be a positive income. And by doing those things right and getting involved, you really change the number of successful outcomes. So a Heart Safe community initiative that we're announcing today has some parameters and some initiatives that we need to, and criteria that we need to meet that we'll be working on over the next 18 months or so. They include establishing a high-performance lead agency and communications team. I think that's been well underway. Develop a process for the collection and analysis and use of cardiac arrest data to measure our performance and progress, to know that we're getting better and let people know that this is actually working. We're requiring 15% of the population to be trained every year with hands-only CPR and the use of an AED every year. And for us, that's between 4,000 and 5,000 people every year with this initiative. Creating a 911 integrated registry. And if you think about that, if someone calls 911, paramedics, and if you have that connected to 911 with a registry of where AEDs are located, you can be working on someone and have knowledge of where the nearest AED is in your proximity as you're involved in that event. And then also strategically locating AEDs in public locations where cardiac arrest is likely to occur 24/7. Malls, schools, things that are open 24 hours a day, and we want to make sure those AEDs are accessible 24 hours around the clock, because you never know what's going to happen. You never know where it's going to happen. And if someone would have said to me, I was standing here 2 years ago, I would have thought, why? And I'm sure when I was practicing on that dummy with Steve, I think, okay, this is fun. I'm probably never going to use it. That was really bad thinking. I think you will use it. I think the numbers are what they are, and we can save lives with this program. And I'm very proud of the community that they're willing to take this step. And I want to thank Steve for his wisdom to getting us involved. I think now, Steve, who's a well-trained, if you're ever going to have a sudden cardiac arrest, there's two guys that are going to come up right now who you want to have sitting next to you. Tim Webb with AMR and Steve Stegman are just going to do a real quick, in the nature of what we're doing here, a real quick example of a CPR save.
So basically, Tim and I are hanging out together like today, and one of you collapse. Once a person collapses, we look at each other and go ahead, Tim.
So we make sure, and just before we get started, one thing I want to add is, please, it makes a difference. As a provider that's working the streets, it makes a huge difference if you do CPR. The success stories that we see are the ones that have CPR done initially by somebody else. We're getting there as fast as we can. Like they all alluded to, we have a fantastic system in EMS here, but we have to have your help, and we need the community's help. That's what's going to make a difference. You see the big-time cities that are doing this, that are really, really good at their numbers, this is what they're doing. They have a lot of people willing to do CPR, and that's what we need. We need your help. Okay, you can save your family member. We have 2 of them here that are survivors. You know, they get to see another Christmas, they get to see another birthday, they get to see their kids and their grandkids, all because of what you may do. We're coming, okay, but we got to make sure that we need the help. Okay, if you can start right away, the odds are incredibly effective. Okay, so like Steve said, if we saw somebody go down, or if you see somebody go down, or you can say, hey, are you okay? Are you okay? Okay, there's no response. We're going to get on the chest. We're going to say, first thing we want to do is call 911. Call 911. And when you do that, the 911 dispatchers are going to talk you through. You don't have to remember any steps. That's how simple this is. They will tell you exactly what to do on the phone. You do not have to be afraid. Don't be afraid to call 911. Don't be afraid to call and get on somebody's chest and start doing CPR, because it'll be extremely effective. Okay, then what we're going to do is I'm going to say, Steve, go grab an AED. Okay. And I'm going to start compressions. Okay, and what I'm going to do is keep my arms straight, my back straight, and I'm going to do compressions right through the center of the chest. This is what we're going to do. And Steve comes in, with the AED. I'm going to continue on with the compressions.
And as Dr. Kramer had mentioned, when a person collapses, there's enough oxygenated blood in the system yet to keep it going. So we're not worried at all about ventilating the patient, blowing in their mouth at this point, okay? So you come along, the AEDs are very much self-explanatory. The main thing is remember to turn it on. Sometimes people forget to turn it on and they haul the pads off. So I'm going to turn it on.
Adult patient.
And I'm going to follow the...
If the patient is a child, press the child button. Remove clothing from the patient's chest.
I'm going to lift this up. Now, a
Remove
lot of
packet
times,
and apply pads on the
it might
patient's
be
bare
a
skin.
scissors handy, okay? I'm going to look at
Apply
the pads,
as shown in the
and it's
picture.
going to show me where I'm going to put the pads.
Remove packet and apply pads on the patient's bare skin. Apply
Take the
pads
second
as
pad.
shown in the pictures. Press pads firmly on skin.
So you basically
Press
follow
pads
what it
firmly
shows.
on skin. Do not touch the patient. Analyzing heart rhythm.
The machine is now analyzing to see if it's a
Do
shock
not
or
touch
a
the patient. Analyzing heart rhythm. Shock advised.
Okay, make
Do
sure
not
everybody's
touch the
clear.
patient.
Okay,
Everyone clear. Press the flashing
see the
shock.
flashing button? That's the button you want to push.
Shock delivered.
And
Begin CPR.
now, you want to immediately begin CPR, you're thinking, well, what if you shock them out? Even if we turn the rhythm around to a normal rhythm, the person generally needs another 2 minutes of CPR unless they start moving around and opening their eyes or whatever, which can happen. So now basically we just go for 2 minutes, keep doing compressions, and the machine will then again stop and say analyze.
Continue CPR.
Yeah. So that we would continue going, and you can go as long as you can. Okay? Anyone can do this. All right? Get on the chest and do the best you possibly can. If there's more people there, get more people to help. But if they see you do it, if they see somebody take the initiative to do it, then more than likely they'll end up doing it. Okay? If they all stand back and everyone's afraid that no one's going to do it, but if you step up and you start CPR, you'll get lines of people that are willing to do it. And that's what we need. That's where we're going to get our success.
Most of the defibrillators, when you hear the clicking, that's the speed that you want to go. Most of the newer defibrillators now, you have to follow the prompts of the machine. And that's what you do. And it'll lead you right to it. It'll tell them,
Continue CPR.
in a minute it'll say analyzing once again. And then it'll continue, and then it'll say either no shock advised or shock advised. Okay? Anything else to add to that? And hopefully, I don't even know how long we've been doing this now, but I would imagine now at this point, fire rescue arrives on the scene. Be prepared to have them either say, hey, you're doing a good job, continue, or
CPR.
step back and then they analyze the patient once again. Okay? Any questions about that?
Before Steve comes up and just makes a few closing comments, any questions that any of these folks can answer for us? Or are we good? Sounds like you guys did a good job. Steve?
Okay, our first big event actually for promoting this is going to be tomorrow at the Senior Day at Central Wesleyan Church. We're going to have a booth there. We have a room set up for mannequins. And again, what we're going to be doing primarily is teaching compression-only CPR. And for a lot of people, that can take 15, 20 minutes, if that, to go in and practice on the mannequins, get a feel for what the AEDs, how they're used. So we're going to be doing that tomorrow. We're also going to be offering classes at Evergreen Commons on Tuesdays and Thursday nights. And you can go to the website. We should mention the website. What's that? It's in the press release. Okay. The website in order to sign up for that. And what we're going to do, Angela's going to keep track of all the people that are interested in taking the course. It doesn't cost any money. You're not going to get certified. So for some of you who need certification for your job, like a security guard or a lifeguard type thing, or even an EMS provider, we're going to be teaching just the compression-only CPR and the use of an AED. We want to make sure that people are not afraid of using an AED, the shocker machine. And so we'll have much more things going on in the paper and so on to encourage. But we've got a lot of people to train, as you can imagine. We got a good thing going. Those schools, the Holland schools are well, a lot of the students, the faculty and so on, they're well trained, and so we're already on the way to getting that 5,000. We got a ways to go though. So anyway, I don't have anything else other than I want to quickly say, maybe I shouldn't. Speaking for EMS providers, you can't imagine the number of times we got on the scene and we thought, why wouldn't anybody help this person? And there were excuses all the way from, I didn't know how to do it, to I took CPR but they flunked me. I didn't pass the course. I didn't pass the written exam. Now, I'm not belittling that at all, because professionals need to know and they need to be able to do high performance CPR. Some medics are doing CPR up to a half hour, 45 minutes, and they keep switching. But we're looking at the time of the collapse to 3 minutes. And all you have to do is push hard and fast on the chest, and you're going to save somebody's life, especially if you can get an AED. And be prepared for a little crackling noise now and then in the chest or whatever. But like John Shea said, he had some sore ribs afterwards. There's no question about that. But when I speak with Lisa and John and what they went through, it's just amazing. So we're really going to be pushing this thing hard and get through the 13 criteria. So someday, when you drive in the City of Holland, you're going to see a sign that says this is a heart-safe community. We hope to. So thank you very much for coming. All right.